welcome to everybody here from throughout the world on the Biocom 2021 virtual conference. And this is the second conference of the year, the February conference, and we're looking forward to hearing a great talk from Nazeema. I'm Adam Cooper, and I'm the president of the Biocommunications Association, and I've been in this association since 1983. So happy to be here. We'll give our speaker a first shot. So Nazeema, you're up next.
Hello, I'm Nazeema. The surname is Ebrahim. I'm married to Hussein Ebrahim, who's sitting next to me. He's signed in, but he's sitting next to me. I'm retired. I'm a retired radiographer, but in the last 5 years of my career at the university, I was actually the director of the School of Medicine. I retired at the end of 2015, but still very involved in academia when I can be involved, such as the meeting tonight. So thank you very much for this plenary session. I certainly am looking forward to doing my presentation. Thanks, Adam.
So I'm going to introduce Connie Johansson now, who will introduce our speaker.
Thank you everyone for being here for Biocom 2021, our virtual conference. Today we have Ms. Nazeema Ebrahim, Professor Ebrahim. She already told you a little bit about herself, but she also mentored medical students with protocol development and publications. She was awarded the J.J. Wesselo Award jointly with her husband, Hussein, by the Professional Photographers of Southern Africa for furthering the interest of police photographers group within the PPSA after her presentation in forensic radiography. And that's what we're going to hear today is forensic radiography. So let's get on with it. Go ahead, Nazeema.
Thank you. I'm just going to take a moment to share the screen. If you would just bear with me. This presentation was actually put together many years ago when I was an associate professor in the Department of Radiography of the University of Limpopo, the Medunsa campus. And we've got the Medunsa campus there because initially the university was called the Medical University of Southern Africa, and it went through 3 name changes. When we talk about forensic radiography, it actually provides one of the most interesting chapters in medicine. And as all of you know, the word is forensis is derived from the Latin word, which means of the forum or pertaining to a court of law. Radiography has become increasingly important as a major diagnostic tool in medicine. And as I've heard from your background, I'm sure that all of you appreciate just what exactly radiography offers in terms of value, whether it's in a deceased or whether it is somebody who's still living and needed to have some investigations done. So the function of the forensic pathologist is to discover the cause and the manner and the mechanism of death. And radiography offers something to see, whereas the clinical diagnosis is still in the mind of the diagnostician, and he needs to have verification of what he might be thinking is wrong with the patient or the deceased. And the value of radiographic evidence to the lawyer is that it's permanent, it's dated, and definite in most cases. Now, I'd also like to just say that every radiograph is a potential forensic document in the sense that you might find that somebody comes along and you say to the person, well, or on the clinical history, it says, well, fell off the pavement. And later on, the person returns and says, well, actually, I didn't fall off the pavement, I was assaulted. And so you'll find that there is actually a legal case that emanates from what the person decides to say after having told everybody that he or she had fallen off the pavement. So right back in the early years of 4000 to 3000 BC, there are written records that reveal problems that were associated with cases in Egypt, Babylon, and in China. And there are probably many other cases where you would find records of forensic investigations. So if we look at the spectrum of deaths, you've got the sudden death or the unexpected death. And when we talk about a sudden death, you're talking about an individual who doesn't know that they probably have a problem. Very often we hear of young people going out jogging and they collapse and they die. And it's because they didn't know they had an arterial venous malformation in the brain. And this pops with the fact that they are running and causing a lot of stress on the body. And in terms of unexpected deaths, it could happen, for instance, especially in females who are diabetic. The peripheral vessels in the body are very, very thin and not well oxygenated. And oftentimes you'll find that a woman just collapses with her face in the plate of food and she's died. And it's an unexpected death in a case, for instance, in a diabetic. And of course, then we've got the suicides, accidents, also brutality in police custody. And then there are medical and surgical procedures that take place where there's a certain neglect while the patient is in theatre. There's general neglect in terms of adults or children, criminal activities, and of course the unidentified bodies. So as we know, radiology is increasingly used also in child abuse and domestic violence, forensic pathology and odontology, that is taking images of the teeth, and you will see some images later on. So the most frequent use of radiography in forensic investigations is detecting and localizing foreign bodies such as bullets and birdshot, but I will show you some examples of other foreign bodies. And it is important that the pathologists retrieve bullets or missiles without marking them with a scalpel or forceps, because as the bullet goes through the body, it might actually have markings on it as a result of bone impaction or anything else in the body that might mark the bullet. So you don't want to add any extraneous markings on that bullet when it is removed. And so the only practical way is with radiography. So when we take radiographs, we normally do them at right angles to each other so that we can look at the depth of penetration, we can look at quality and caliber of bullet, and we can establish angle of entry. And the basic questions that we ask ourselves is the wound being examined a gunshot wound? Is it an entrance or an exit wound? What type of gun was used? What was the range of fire? What was the direction of fire? What were the relative positions of the gun and the victim? Did the gunshot cause the death? Because sometimes people are poisoned and then shot, or they sustain a different injury and then shot. And the question is, how many times was the descendant shot? Now, Hussein and I were relocated from the UK. We were headhunted to work at the Medical University of Southern Africa. And I've just given you a small map here. We joined the university in 1982. And our daily route was traveling along a road through an area called Baputa Tswana, which was in fact a Bantustan that was created by the apartheid government. And the Medical University of Southern Africa was also created by the apartheid government, mainly for training health professionals in amongst the Black community. And on the 12th of March, 1994, Hussein and I were traveling through the road when we met up with a group of young Black people yielding trees and various grass cutting instruments, and they were coming towards us. And I said to Hussein, I think you should put your hand out and pump the air and just say, we're with you. And he says, I'm not doing that. And I said, I think you should do that. And we both did it, and they parted. And of course, with all excitement, we went to our various departments and we told people what was happening. And as we arrived in the X-ray department, as I arrived in the academic department of the university where I was then lecturing, the telephone rang And it was the chief radiographer requesting that all of us working in the academic section of the university come over and assist, because the X-ray department was a bloodbath. And what in fact happened was that the police shot, I think about 40 people actually died during that uprising. And the uprising was about the fact that young people wanted to be incorporated into South Africa because they needed work. And in fact, later on, Botswana became part of South Africa. And here you see an image of a child. The epiphyses are still not united. The kidney on the left is hydronephrotic, hydroureter. And on the right side, this kidney has been shot, virtually torn apart. And if you look at this image, we don't know how the patient was shot or from what direction until you get a lateral. And here you can see this child was probably running away and being shot with birdshot in the back. Now, when we were in the X-ray department, we had a lot of police in amongst us, and all they said to us was X-ray, just X-ray. And on occasions we would say, but we need more than one X-ray. No, 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 just do as we say. So there were some adults that sustained birdshot in the head. And there we have a lateral view that we were lucky to be able to do, because they just wanted everybody to be out of the X-ray department. So of course, this patient would have to go for CT scanning to determine whether any of these birdshot penetrated the sinuses. It doesn't appear as though it's penetrated the skull at all. Some got off lightly with birdshot in the arm. So now the more recent hazard, and I don't know how many of you actually have had experience of this, where you actually have bullets that explode on impact in the body. And it's very important then that we do not use ultrasound, because ultrasound can actually cause the bullet to explode. So this is why plain Jane X-ray technology is the way to go. Here, in the same instance where these people arrived in the X-ray department, you will see that this individual was actually shot with a bullet. And you can see that the bullet goes down towards the pelvis. And we were told, no, 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 that's enough. We just need to see that. So, of course, there was limited reporting on these cases, and we had no control over what was happening at the time. I was assisting with taking X-rays of most of the patients, while some of my colleagues were portering and others were mopping up blood, etc., etc. And then they brought this body in a bag, and they said, just X-ray. And it was a very, very tall body. And we said, well, can we take the bag off? And they said, no, no, just X-ray the body in the bag. So we put the patient on the fluoroscopy machine, and here you can see there's a bullet lodged up in the chest, but you can also see that there's been some hacking, because there you have part of the anterior lumbar spine separated from the posterior lumbar spine. Now, it would have been very interesting to be able to do oblique X-rays and lateral X-rays, but we couldn't do it. We were told, that's it, that's all we need. So under duress, that's what actually happens during a political climate, that you actually do not have your own will. There are times when radiographers need to take mobile equipment to X-ray mattresses, furniture, and wooden floors. And these would be industrial machines where we actually go out on site, maybe in a house or so. So in terms of radiography, we need to understand that it's important to determine the number of bullets in the body, and where there is no exit wound, we need to know whether the bullets in the body actually correspond with the number of entrance wounds, so that we can determine that when bullets are retrieved, that the full sum have been retrieved for inspection. And as you know, we need to find out what role these bullets may have had in the case of death, and whether different firearms were used to shoot the person. And there might even, in fact, be survivors of bullet injuries. Now, occasionally, the person doesn't actually die from being shot But what happens is that if that bullet is anywhere near the bloodstream, it can actually go into the bloodstream, carried away as an embolism, and the person dies from the embolism and not actually from the initial shot. So after removal, as many of you will know, bullets are inspected and they are weighed, and this is done by the police ballistic experts. Now, when bullets penetrate the skull, we take the brain and it is very carefully handled and put on the mammography machine, and we use what is known as a localizing cone in order to track exactly where the bullet is. So we've got columns and numbers, and if the bullet were perhaps in column B, row 3, that would give the forensic scientist a clue of where the bullet is. And they handle the brain very carefully because you do not want to have any extra injury to the specimen apart from removing a bullet for inspection. So, besides bullets, we also take x-rays of knife wounds, glass. It depends on what type of glass. We don't always see glass, and the same with wood fragments. We don't always see wood fragments. Now, this is a typical Saturday night casualty of somebody who's been stabbed. And as you can see, the part of the knife has actually broken off into the orbit. And when you look at the lateral, you can see how it's actually bent. And this is absolutely a beautiful lateral because you can see the pituitary fossa very well superimposed. And this is the ideal. You want to have good quality lateral radiographs. This is a case of a gentleman that I x-rayed who had come in also on a Saturday night, walking into the x-ray department with a knife through his nasion. Luckily, it didn't penetrate his eyes. And so when we did the lateral, you can actually see the hilt of the knife, showing once again a very good lateral x-ray. So he was very lucky. Now, this is another case of an injury with an instrument. You can see the crescent shape there. And to the untrained eye, you probably think, well, that's the only injury. But when you take the lateral radiograph, you actually see that the frontal part of the skull has also been traumatized. So when we go back, you can see the difference between right and left. So you can conclusively then go back and say that the injury is on two parts of the skull by virtue of the fact that we've got a lateral image here. There are other foreign bodies that we also locate, and they can be retrieved for further investigation for the cause of an accident. And here we have a young child who was sitting on the back of a light transport vehicle without a canopy on a farm where her father was driving. And she was playing around in the back of this vehicle and she fell off. And there you can see gravel. Now, it's not a good radiograph, but it shows the gravel. So the radiologist said, well, look, just accept this. We'll go ahead and do a lateral, and there we can see how the skull was actually penetrated. She went on to have a CT scan. All the gravel was removed, and she's lived. She actually lived, which is a good news story. We also had incidences, and this is where we come to the deception part of the talk, where prisoners would inhale or swallow foreign bodies so that they could actually be admitted to a ward and plan their escape. And very often in the hospitals where I've worked, we've had prisoners chained to their beds and being observed by police because they had planned with outsiders as to how they would like to get out of prison. And this particular prisoner went to the sick bay complaining of a very, very hot head. And when the nurse took his temperature, he swallowed the thermometer. So he obviously needed to go to theatre to have this thermometer retrieved. And if this was a mercury thermometer, it would have to be retrieved very carefully to prevent mercury poisoning. Now, there was a time when abortion was illegal in South Africa, and so women would go to backstreet abortionists. And here we have a case of desperation where a woman goes along to a backstreet abortionist and there's a crochet needle in her pelvis. And there you can see it on the lateral. So they come to hospital, often septic and quite ill because they would have waited a few days before they report. As you know, smuggling of drugs is a big problem, and radiography plays a big role in detecting. Swallowed condoms, and here is an X-ray on a viewing box. I actually took this from a newspaper because it made headlines. And this then appeared a month later in our radiography journal. And here you can see the condoms filled with drugs. And on CT scan, you can actually count them and see the shapes of them. And I believe that before they swallow these condoms, they practice swallowing big globe grapes or big pieces of sausage to expand the esophagus before they actually swallow these packages. I had a habit of wherever I worked, I would go to theatre and ask the theatre nurse of all the instruments or let's say swabs that they would use in theatre, and I would always make a template because every swab used in theatre has a radiopaque thread. And oftentimes we get requests to X-ray patients after having abdominal surgery where the patient has septicemia or they've got a fistula that's tracking through to the skin, and we've got to X-ray them, and invariably one sees a swab that's been left behind. So that's good practice to actually have a template in the X-ray department of what's being used in theatre. So when it comes to identification, it is sometimes a very difficult problem. And the whole idea is to be able to name a subject who has died of suspicious causes, whether it was a criminal or obscure death, or whether it was mass disaster, genocide, or war victims. And the deceased may be unidentified because of deliberate attempts at mutilation or concealment. And so what do we look at if we find a bone in the veld somewhere in the field? You've got to determine whether in fact the bone belongs to a human or whether it is an animal. Determine the gender, the age, race, and stature. And also sometimes habits. When it comes to teeth, you will see that they're chewing grass, so the teeth look a bit green. And one of the atlases that's used to determine age, and to this day still being used, is a Gruelichen pile that gives you an approximation of what the age is of an individual. And it's a very big atlas still being used, but of course, depending on where you're born and where you live, the anatomical structure would differ, also depending on nutrition. So later in life, determining age is difficult, but assessing tooth rarefication and remodeling of cancellous bone in humerus has proved useful. Also the pelvis and the pubis. And here we have a 23-year-old male. You can see a nice big sturdy bone of the humerus there. And then the delicate 23-year-old female. And if you look at the pubic bone of a male versus a female, you can see it's almost half the width in a female. So rib patterns, teeth and frontal sinuses and skull parameters assist and are of great value in determining abnormalities. And here we have a specimen of a clavicle that was found after the body had decomposed. And when the family had actually brought X-rays along to the forensic scientists, this gentleman had been X-rayed before, and he's got cystic lesions in the clavicle, which still present themselves in the bone that was found, so they could identify the individual. So mostly we look at visual examinations of faces, but oftentimes due to putrefaction or mutilation, it's very difficult, as in this drowning case here. And the question is, did the person die from drowning, or did the person get poisoned and then drowned, or was the person shot and then drowned? So the frontal sinuses are often used as anatomical regions for identification. And there are some military personnel who request that new enrollments have their sinuses x-rayed and put in their files, because should they be shot and not found, and their bodies are found much later, they can actually take measurements from the sinuses and match them, because no two sinuses are the same, not even in identical twins. Now, the enamel of human teeth constitute by far the hardest tissue in the body, and they're protected by a large extent by the soft tissues, the cheek and the tongue, and it insulates them from trauma and high temperature fires. So oftentimes one finds teeth when a body has been burnt. And the usefulness here is that we can look at some of the complex and variable structures in individuals, in as far as the shape, the number, histological structures, arrangement in the jaw. These days, if they've had any implants, root implants or dentures. And oftentimes the forensic dentist is faced with an unknown body and is requested to demonstrate who that person might be and determine their age, race, occupation, habits, gender, and various pointers as to previous histories. And so here you have supernumerary teeth in children. That's a much younger individual. Here you've got fewer supernumerary teeth. And here we have a case of a root canal treatment that was done. And sadly, we had a medical student who was in a final year who was murdered by her husband. And they both worked at the university. And for a week and a half, the helicopters were flying over the university, throwing out flyers. Have you seen her? Have you seen her? Any idea of where she might be? And eventually she was found, and the body was so badly decomposed that the only clue to who she was in fact radiographs similar to these. It's not hers, where she had had a root canal with fillings, and that's how they could actually identify her. There were times when skull x-rays were superimposed on passport photographs, but of more recent times, with 3D scanning and with facial reconstruction, you can see how one can actually see the features of this young individual. So the imaging modalities that we use are X-rays, ultrasound, magnetic resonance, CT, angiography, fluoroscopy, and contrast media studies. I've spoken about Munschausen syndrome when we last met in Asiloma, but there are a few more images that I'd like to show you, and this happens predominantly in amongst women who want to show the doctor how much they care for their child, but then they actually put objects near the child or into the child so that they would like to actually have the child die. And here is a situation taken from a book where an individual left watch batteries lying around so that the child would swallow it with the hopes that the battery would corrode and the child would die. Here we have a situation where a nail was left around the house and the child swallowed it, and you can see that there's extensive pneumonia, bilateral pneumonia, because it was sitting in the esophagus, but it obstructed the saliva going down into the lungs as well. And this was the image that we saw at Asiloma, where needles are inserted in areas where doctors would not see. And this is why we would always take all the clothes of a baby, take off the nappy, and look for telltale signs like little flea bites, because they would put it into the genitalia or under folds of skin to hide exactly where they were putting needles. Here is a case of a mother who actually put caustic soda in the child's milk and the esophagus gets eroded to an extent where there's large expansion and sometimes fistulae form, and here you can see that it's actually gone into the lung. Here, a crochet needle was pushed into the anus of the child, penetrating the lung, resulting in a pneumothorax. And so these were the references that I used to compile this talk, and it was given many, many years ago, and it is still currently being given when requested. And this is where Hussein and I received the J.J. Veselo Award for our contribution to police photography group as a token of appreciation and recognition to individuals who have given time, effort, and dedication over the years to forensic science. And as you can see, we retired now, but that was a long time ago. I think we were in our 30s at that time. Thank you very much.
Thank you, Nazeema. That was awesome. Besides say thank you to Nazeema for the presentation, give her a big shout out because it's her bedtime almost. It's like 9 o'clock in the evening there. So thank you very much, Nazeema, for working with me for the schedule and to find a decent hour where most people can attend.